and work certification requirements. So this is something that physicians are going to need to pay special attention to. It will impact some of the administrative needs of your offices and your staff, but there are steps you can take to streamline some of this and incorporate this into your workflows. So with that, we are going to go ahead and get started today. I just want to remind everyone to keep yourselves on mute. If you're not talking, that would be much appreciated. And if you have questions, please go ahead and enter them into the chat so that when we are finished with our keynote speaker presentation, we can go ahead and field your questions. We'll read them aloud so everyone can hear them. And at that point too, we can always open it up to verbal questions. So I am really honored today to welcome Sandra Bowlan, who is MPA and Deputy Director for Riverside County Department of Public Social Services, Self-Sufficiency Central Hub Team, and STAR in Riverside. Ms. Bowlan has dedicated 26 years of service to Riverside County Department of Public Social Services, building a distinguished career centered on strengthening families and supporting community well-being. She began her journey as a Medi-Cal eligibility technician, assisting families in accessing essential health coverage. She later served as an employment services counselor, where she helped individuals achieve self-sufficiency through employment and education. Over the years, Ms. Bowlan has advanced through multiple leadership roles, including supervisor, regional manager, and deputy director. She has overseen all programs within the Self-Sufficiency Division, leading teams and initiatives that directly impact the county's most vulnerable residents. She now serves as the Deputy Director of Administrative Services for the Self-Sufficiency Division, where she continues to champion effective service delivery, operational excellence, and community engagement. She also provides oversight of the Medi-Cal program, ensuring staff have the tools, training, and resources needed to best support the community. Ms. Bowlan is deeply committed to helping families and residents navigate critical resources with dignity and compassion. She holds a bachelor's degree in business administration from California State University, San Bernardino, and a Master of Public Administration from California Baptist University. Ms. Sandra, we are so excited to welcome you. I'll turn it over to you.
Thank you so much, Allison, and thank you everybody for joining us this afternoon. So today I want to go over the Medi-Cal Redeterminations, work requirements, and other policy changes that have come about due to our HR1 implementation, and how physicians and staff can support the continued patient eligibility. So moving on to the next slide. Today in the agenda, I want to go over the Medi-Cal HR1 updates that are impacting 2026 and 2027. This is just a list of a few of the items that we'll be discussing, as well as some of the community communication, as well as community outreach that we are doing in Riverside County, and how you can support. Next slide. So we'll go over the changes that HR1 has brought about for Medi-Cal. Next slide. So starting with what's already been implemented. So as of January 1st of this year, the first thing that has been implemented has been the property limits. So property limits are now something that we have to verify for adults. And those are adults who are 65 years or older that meet the household income for Medi-Cal. And those individuals that are disabled, those individuals that are living in nursing homes, as well as those families that make too much money under the to qualify under the federal tax rules. So we will be verifying property when a person comes in to apply, or at their annual redetermination, or anytime there's a change in circumstance. And what counts as a change in circumstance is anytime there's a change in income, or if there's a household change, someone comes in and out of the home, or there's any other program eligibility that may impact their benefits. The property limits are now $130,000 for one person, and each additional person has a $65,000 limit, and it goes up to a max of 10 individuals. The next thing that has, the next policy change that has come about and has been implemented is the Medi-Cal expansion freeze for adults that are 19 years of age or older, and these are individuals are without satisfactory immigration status. So as of December 31st, these individuals were grandfathered into full scope Medi-Cal. So if they were on Medi-Cal prior to December 31st, they will continue on full scope Medi-Cal. But effective July 1st of 2026, this will change to full scope Medi-Cal without dental coverage. So dental coverage will be removed from these individuals. Anyone who's coming in effective January 1st of 2026, that falls under the age group of 19 years or older without satisfactory immigration status, those individuals are now considered to have restricted scope Medi-Cal. And restricted scope Medi-Cal is basically individuals that will only be able to get services for emergency care, pregnancy-related care, or nursing home care. So those are the only types of services that you can get under restricted scope. Now, for those individuals that fall under the full scope Medi-Cal under this group, if at any point they get discontinued, maybe failure to provide their annual redetermination, they have a 3-month grace period to restore, provide any documentation so that we can restore their benefits. If they do this within the 3-month grace period, the 90 days, then they will be restored to their full scope Medi-Cal. If they miss this 90-day grace period, then at that point, they would have to reapply and then come back on with restricted scope Medi-Cal. So one of the things that we're really trying to do is prevent this group from losing full scope Medi-Cal and doing a lot of additional outreach. Now, this will not impact children ages of 18 or under, or those individuals that are pregnant or a year after their pregnancy ends. Next slide. So as of July 1st, dental coverage will be impacted. So these beneficiaries without satisfactory immigration status will not be provided dental. So the only individuals that will be exempt from this under this group will be, again, individuals who are pregnant or after a year after their pregnancy ends. Those individuals that are former foster youth under the age of 26, but were in foster care on their 18th birthday. All other individuals will only get emergency dental care, and emergency dental care consists of only a serious tooth pain, if they have an infection, or if they need a tooth extraction. So they do not get preventative care. Next slide. Another change that will be coming is on October 1st of this year, we will have an immigration status change. So the federal government will change how they classify certain immigration statuses. One of those being refugee or asylees, humanitarian parolees, and those individuals that are survivors of domestic violence or human trafficking. Those individuals are currently getting full scope Medi-Cal. We're still pending more details on how these changes will be implemented and how they will impact the benefits for this group. So more information to come on this, but the change is coming. Next slide. Next year in January, these are some of the major changes that are coming, and we know this will have a huge impact on our population, and it's work requirements and community engagement activities. So adults ages 19 through 64 will be the ones who are impacted, and these are any individuals that are eligible for Medi-Cal under the Affordable Care Act expansion and don't need an exemption, which is in the blue. They will be required to participate 80 hours a month in one or a mix of the following activities. So it could be work, And with work, they have to have a monthly earned income of 80 times the federal minimum wage, which is $7.25. So that would average about $580 a month that they would need to make in order to meet this requirement. They can also participate in a community service activity, be enrolled or at least half the time in an educational program or a work-related program. So we will be verifying their work requirements or community engagement at application or at each redetermination. So this will be a pretty significant impact. Some of the individuals that will be exempted from this activity will be those children under the age of 18, adults that are 65 or older, pregnant individuals in a year after after they've given birth, parents who have children under the age of 13, individuals with disabilities. And I highlighted this one, people with serious health or mental health conditions or substance use problems, because this is one that we will be leveraging our healthcare providers and teams to assist us with. People who were released from jail or prison within the last 90 days, those individuals that are on Medi-Cal Part A or Part B, American Indians or Alaskan Natives, former foster youth or foster youth under the age of 26. Next slide. So also in January, we will have the annual redeterminations now move to semi-annual. So every 6 months, we'll be completing redeterminations for Medi-Cal for the adult groups of those ages 19 through 64. Anyone who fails to turn in their semi-annual redetermination will lose their coverage for Medi-Cal. Individuals that will continue on their yearly redetermination will be those individuals who are not under the Federal Care Act. Also, individuals who are pregnant or a year after their pregnancy has ended. Alaskan Natives and American Indian members and foster youth and former foster youth under the age of 26. So this one will have significant impacts because it will hit a large population and it does create a lot of work for our counties as well. Next slide. Also, in January of 2027, we will have reduced retroactive Medi-Cal timeframes. So today, a person can come into Medi-Cal and we will utilize their application date. If they have bills prior to them applying for Medi-Cal, we can look back 3 months, and if they are eligible, we can cover those bills through the 3-month retroactive period. Effective January of 2027, that will change and those timeframes will be reduced. So individuals that are adults without children, their timeframes will be reduced to only 1 month prior to application. All others will fall under the 2-month prior to application to cover those bills. Next slide. So as of July 1st of 2027, we will another change will be monthly premiums. So that same group that we discussed, the 19 through 59, who are either undocumented or without satisfactory immigration status, those individuals now will be required to pay a $30 per month to keep that Medi-Cal full scope without dental. So that same group now will have a monthly premium of $30. If they do not pay or cannot pay, then they will be switched over to restricted scope Medi-Cal. Next slide. So we kind of went through quite a few changes for 26, 27, but a big piece on this that I want to share, and for Riverside County, when we talk about the major impacts, Riverside County currently has about 837,000 individuals who we service through Medi-Cal. And out of, with all these policy changes, they will be impacting about 304,000 of those individuals. So we know it's going to have a significant change in our residents. And within the Inland Empire, most of our counties are about a similar size, and we tend to cover about the similar caseload when we're talking about San Bernardino and Orange County. So some of the things that we're doing in regards to communication and outreach to avoid our residents losing coverage are the following. Next slide. So we are currently in Riverside, as well as our surrounding partners, county partners. So we are participating in state-led work groups to make sure that we're staying informed and looking at ways to improve communication within our for our residents. We're also participating with local labor and work development work groups to try to figure out how we can create opportunities for our customers so that they are able to participate in different community engagement activities, look at more work-related opportunities for these individuals so that they don't end up losing their benefits because they can't access one of these activities. We are also, we've increased our social media, our communication through social media, our Benefits Cal. We've been on podcasts to share some of this information. So if we can get as much information out to the community, hopefully we can prevent the loss of coverage. We do community outreach events. We have 4 community outreach vans that go out to different parts of the county, especially those rural areas. It's basically an office on wheels, and we provide services that way, and we share as much information with the community so that we can provide them services and get them on benefits so they can get access. We are also working on and have been sending out outreach materials to our residents, including flyers. We have scripts that our staff follow, and they also have frequently asked questions that they have available to them so that when customers call in, we know how to answer and provide them the correct information according to what DHCS has provided. We've also instituted monthly robocalls to do reminder calls in addition to all the outreach materials to our residents that are coming up due for an annual redetermination so that they're reminded to turn those in on time. So there's just a few of the things that we're doing within our county. Next slide. Some of the things that you can do to assist, so for our physicians and staff and how you can support so that we can continue the patient eligibility. So the first thing that you're doing already is showing up and staying informed. That's really key as things continue to change. Another area is that DHCS is currently working on a state eligibility system to automate communication. And they're working, for example, with managed care plans so they can get timely sources of exemption data. They're looking to get information if a person can be exempted from the work requirements, and then being able to provide us that information so that we can exempt them on our end and not cause any loss of benefits there. So that system is being worked on. We don't have a date of when it'll be available or ready to go. So in the meantime, some of the things that we'll probably be leveraging are physicians and healthcare providers are going to be the continued completion of the Medi-Cal forms. So there are forms that we provide our customers so that they can show their providers what, and have them complete so that they can say whether a person can be exempted and timeframes for that exemption. So those are forms that will be needed to be completed in order for us to exempt anyone from work requirements or any community type engagement activities. Another thing that can be really helpful is just reminding patients that are on Medi-Cal to make sure that they're updating their addresses and phone numbers with their county workers. That is one of the areas that we do end up losing communication with some of our customers if they move and they forget to share it with us when that packet goes out we will have it be returned to us, and there's no way of us getting a hold of those individuals, and that's another way that we would like to prevent that loss of coverage. So if just working together to communicate and leverage our resources to keep individuals on, as this will be a pretty significant impact to the individuals that will be able to get full scope Medi-Cal. And that is just a quick presentation of some of the changes that are happening in the next 2 years. So that is all I have. So are there questions?
That was really great, Sandra. Really clear as far as your timelines and exactly what to expect. And thanks for including the section about what physicians and their staffs, and I think social services partners can do as well to make this a little more streamlined while you work on the eligibility system. That sounds like a huge project.
It's going to be huge. It's a huge undertaking for everybody involved. So.
Yeah, well, that's amazing. Well, right now we have a couple of questions, and the first one, I want to also introduce the person asking the question, Dolores Green, who's the CEO of Riverside County Medical Association, who's our partner and co-host in this series. Dolores is very, very engaged in this, and RCMA has a wonderful resource toolkit on their website with regard to implementation and changes of the Medi-Cal requirements and the outcome from HR1. So Dolores's question is, for the work requirements, is it each adult person in the household, or does one just have to meet the work requirement?
Thank you for the question. So as of right now, what we understand is each adult needs to meet this requirement, but we're still working with the DHCS to get more information on what they're working on, because they are trying to streamline a lot of their communication and a lot of their of what processes are changing with also CDSS, because we also have some work requirements for our CalFresh participants. So there's some alignment that they're working through, and they are pending providing us more information on how this will truly be impacted. But as of right now, what we know is that each adult is required to participate 80 hours a month.
Do you have any other comments or questions, Dolores? Did you want to add anything? No? Okay. Thank you. All right. I have a question for you, Sandra. What's the difference between undocumented and lack of SIS or UIS? Or is that when the refugee and asylee classifications come into play?
So the without satisfactory immigration status, that the difference is, for one, well, it's basically the same thing, but one of the things that they are assessing is what we once considered as verification that they did have temporary status, immigration status that was satisfied, now is one of those things that has been is being questioned or being reviewed. So as of right now, what it's anyone who is not a resident with a green card or a naturalized citizenship. So.
Okay, great. Thank you so much. And Erica Lopez has a question. Erica asks, is DHCS still trying to validate exemption via provider claims data?
So what we know right now is that they're going to try to utilize every source or every system available to them to validate the exemption data. I know that they have a few different methods that they're using, and I believe that's one of them. But they're still working through all of those pieces and what will actually be leveraged.
Wonderful. Yeah. All right, great. There are no more questions in the chat. We have a quiet group here today. Does anyone else have any question or comment? You can either raise your hand in the chat or go ahead and speak up and ask your question. We've got the expert on the call here with us. So this is your chance. Now, my gosh, we might have to give you all some time back today then. Well, a couple of things. I do want to remind you of our next session in this series, which is coming up on March 18th, and that's with Janice Rocco, the Chief of Staff for the California Medical Association, and she's really going to focus on the policy aspects of HR 1. And so it will reinforce a lot of what Sandra just talked with us about. But it will also discuss some of the advocacy efforts at the federal level with regard to is there any hope for reinstating ACA premium tax waivers and that sort of thing. So I think that is a dead issue at this point, but these efforts are always ongoing. It's never over till it's over. So this is all, it's going to be evolving before us for quite a long time. So Janice will have some terrific insight on this, and she's really an expert in this and works very closely with DHCS and the counties. And then finally, on March 25th, closing out the series will be James Locurto, who is, I believe, Sandra's counterpart at the county of San Bernardino. And so he'll be talking about requirements that might differ from Riverside with regard to San Bernardino County residents and their Medi-Cal coverage and requirements. So these are all going to be wonderful sessions coming up. And Janice, thank you for posting those. That's amazing right there, right in front of us. And you can sign up for these on our website. Registration is very easy, 1 or 2 clicks. And then finally, I want to mention a couple other things. I told you that Dolores Green and Riverside County Medical Association has a wonderful Medi-Cal updates toolkit for physicians and practices and ultimately for patients on their website. We also want to remind you that IEHP has a toolkit and a resources page on their website. And finally, DHCS has an overview and timeline of the rollout of all of this. So it will all kind of mirror each other, but there may be nuances and a few differences between each that between all of these wonderful resources and documentation of what we can expect. I think we'll learn more comprehensively what we can do to support this process. Let's see, was there anything else I missed? Yeah, we will be sending out a copy of the slides. Thank you very much, Sandra, for giving us permission to do that. We will send out a copy of this recording by email to everyone who registered for this webinar. So last chance, no more questions?
Thank you for making it easy for me.
Well, thank you. I think you answered everyone's questions. I think that's what happened. So thank you very much, Sandra. You were wonderful. We sure appreciate it. And thank you all for joining us. We'll give you back the rest of your day, and we will see you March 18th. Okay. And don't forget to tune in February 26th for our clinical education series on lifestyle and wellness for longevity. All right. Thanks, everyone. Have a great rest of your week. Bye-bye.
Bye.